Hi guys, welcome back to my YouTube channel. My name is Peace. I'm a nurse by profession. Today I bring to you a very important topic all the way from Zonal Hospital, Okrika in River State, Port Harcourt, Nigeria. We were posted here for our community posting, so I decided to make a video and share what is actually happening in the world, not only in River State, not only in Nigeria, but all over the world. According to the International Agency for Research in Cancer, they say that cervical cancer is on high rate in sub-Saharan Africans, and also 34% of people in East Asian country are suffering from cervical cancer. Do you know 1 in every 5 women die of what? Cervical cancer. So, what is cervical cancer? Cervical cancer is a cancer that grows in the cells of the cervix and spreads from one place to another. So, what causes this cervical cancer? Cervical cancer is caused by what we call the human papilloma virus. And also, another causes of cervical cancer is having multiple sexual partner. Another thing that causes cervical cancer is smoking. What else can cause cervical cancer? Hereditary, family history of parents, past parents having cervical cancer. So another thing that can cause this cervical cancer is what? Having what's being sexually active. Yes, there are people that are sexually active from small. They've already started indulging in sexual relationship. So how, what can we do about this cervical cancer? What will you do? Early screening and early detection of cervical cancer can help us receive adequate and immediate prompt treatment. So what are the tests that you will do or diagnosis that you do to find out if you have cervical cancer? We have the pap smear. This pap smear, they use a swab stick to collect a sample in the cervix and they will run the test. This pap smear will produce a percent result is accurate. Once it's out, if it's positive, it's positive, if it's negative, it's negative. Another one is the other method that we do with the use of acetic acid and normal saline. We sprinkle little of it into the cervix to check for changes in coloration, which when you see a white spots in the cervix, in the mouth of the cervix, it means it is positive. So what are the symptoms or signs and symptoms of this cervical cancer? Number one, they have severe pain in the pelvic region that lasts for a long period of time. Number two, they have bleeding in between periods. Number three, they have bleeding during sexual intercourse. And number four, they bleed unusually, which is not normal menstrual period, they just bleed unusually. So how else can we, what can we do to prevent this cervical cancer? Is early what detection. They said prevention is better than cure. So when you are up to the age of from 21 to 65 years of age, it is advised that you go for what? For your cervical cancer screening. And for those who are not yet sexually active, we advise parents to do what? Send their parents to go for HPV vaccines. HPV vaccines is not only for females, it's also for both sex, because you can get human papilloma virus from what? Multiple sexual partners. So that is why we advise people to avoid multiple sexual partners. Stick to one partner and make sure you always go for screening and make sure you always go for tests to know that you are confident, your health is okay and you're doing well. So what else can we do? It is also important that pregnant women go for what? This cervical cancer screening. Although some pregnant women are already positive cervical cancer patients and they are pregnant, what will they do? Once you realize that you're pregnant and you've been tested and you have cervical cancer, you will rush, there is an immediate prompt treatment they will do for you. That is what we call colonization. Colonization is shaving out that part which the cancer has spread in the cervix. That particular part in the cervix that the cancer is, it will be shaved out. Loop electrosurgical procedure is a procedure that an electrical loop is heated and it is used to remove that heated loop will be used to scrub out the parts that the cervix, the cancer has spread in the cervix. So there are other procedures. So these things we are careful in terms of pregnant women because it might lead to something else. So if you have this cervical cancer as a pregnant woman, it can cause preterm labor. It can cause bleeding from, and it can cause miscarriage. So as a result of this, once you realize or you went to the hospital and they tested you, you are positive with cervical, your test results comes out positive, please make sure you do not go away. Do not be afraid, do not be scared. It's to save your life and that of your child. Make sure you take your adequate treatment and make sure you start your treatment as early as possible to prevent further spread of the cancer to other reproductive organs in your body. It is good for us to do this test because once your reproductive organs are damaged or affected, the ovaries and every other part they are affected, my dear, it will do what to prevent you from what having what children. Then I want to tell you that the reason why this cervical cancer we call it a silent killer is because it cannot be seen. It does not produce immediate symptom. You cannot see experience any form of symptom until it has started spreading very, very fast. So it is unlike breast cancer. It is unlike breast cancer that when you palpate your breast, you examine your breast, you're seeing your breast, you examine it in the mirror and you palpate and you feel some lumps, you feel uncomfortable, you go to the hospital and you see it. This one is right inside the cervix, and the cervix is the connection between the vagina and the uterus. The uterus is the womb. So before you can see something inside, you will need what? The use of what we call vaginal speculum. And you cannot even do that by yourself. You have to go to the hospital for them to do that, open it and examine and check your cervix. So please, why not visit the nearest hospital in your country, in your hometown, wherever you are, and make sure you do this cervical cancer test, screening test, so that you will be free from anything that will predispose your life in the future. This test is done in River State Teaching Hospital, Port Harcourt, Nigeria. It's also done in Zonal Hospital, Okrika, River State, Nigeria. Okrika is a beautiful city. If you don't want to come through boat, you can come through land. It is when you get here, it is free of charge for the screening. So why not grab this opportunity today? Women, let's try and help ourselves because we are heroes and we need to save the world. We are here to save the world. We are here to protect our children. Make sure you go for your screening today. And health is wealth. Thank you for watching. In my next video, I'll be sharing more lights on cervical cancer screening.